Hemorrhage is defined as the escape of blood from a ruptured blood vessel, which can occur either inside or outside the body. It can result from injury, disease, or a blood clotting disorder. Hemorrhage is categorized into several types. Internal hemorrhage involves bleeding inside the body, while external hemorrhage means blood escapes through a wound or body opening. Postoperative hemorrhage is excessive bleeding that occurs after a surgical procedure. It is a serious complication that requires prompt management. Based on timing, hemorrhage types include primary, occurring during or immediately after surgery; reactionary, happening within 24 hours; and secondary, occurring after 24 hours, often due to infection. Based on the source of bleeding, hemorrhage is classified as arterial, which is bright red and spurting; venous, which is dark red and steady flowing; or capillary, which is slow and oozing. Hemorrhage can also be classified by severity. Mild hemorrhage may stop with basic care. Moderate requires medical attention. And severe hemorrhage is life-threatening and needs urgent intervention. This video will cover the classification, causes, complications, and management of postoperative hemorrhage. Surgical causes of hemorrhage include incomplete hemostasis, where blood vessels are not properly sealed. It can also be due to slipped ligatures or sutures, or excessive tissue trauma. Patient-related causes include hypertension, blood clotting disorders, or the use of blood-thinning medications, which prevent proper clot formation. Infection and wound complications can also cause bleeding. Bacteria can erode vessels, leading to delayed secondary hemorrhage. Wound dehiscence or wound opening can also damage blood vessels. Mechanical factors like coughing, straining, or vomiting increase pressure and can disrupt surgical wounds. Early removal of drains or packing can also lead to premature bleeding. Underlying medical conditions, such as liver disease, which reduces clotting factor production, or kidney disease, which causes platelet dysfunction, increase the risk of bleeding. Complications of postoperative hemorrhage include hypovolemic shock, hypotension, tachycardia, hematoma formation, and potentially organ failure. Immediate first-line management involves assessing vital signs, applying direct pressure to external bleeding sites, and positioning the patient by elevating the legs to manage shock. Fluid and blood replacement includes administering intravenous fluids to maintain blood pressure. Blood transfusions or clotting factor replacement may be necessary for significant loss or coagulopathy. Medical management involves using hemostatic drugs to stabilize clots, reversing anticoagulants if necessary, and correcting underlying conditions like hypertension or infections. Surgical procedures may be required if bleeding continues. This includes wound exploration and reoperation to find and stop the source, using electrocautery or ligation, or packing the wound. Thank you for watching this video on postoperative hemorrhage.